So in the earlier class, we were discussing about the levomethol, tetramethol, and also the ivermectins. So today we will deal about the tetrahydropyrimidines. That's one of the class of the anthelmintics in which we are, yes, definitely we will see the different anthelmintics like PYRANTEL, MORANTEL, and OXANTEL, especially PYRANTEL, MORANTEL, and OXANTEL. Then coming to the first agent, that is the PYRANTEL. It was introduced in 1950, one of the oldest anthelmintic, and it's having the commercial use. It is in the salt like PYRANTEL tartrate or PYRANTEL palmoate salt. Whereas the PYRANTEL palmoate occurs as yellow to tan solid, and especially it is practically insoluble in water. So the mechanism of action of this PYRANTEL is nicotine-like depolarizing neuromuscular blocking agent. So you have already learned that the depolarizing neuromuscular blocking agents, how they are going to act. And it causes the activation of nicotinic cholinergic receptors, whereas it is going to produce slowly developing contractual and spastic paralysis of the parasites. And also it inhibits the formation of the acetylcholine. So ultimately, the worm will get paralyzed and are slowly expelled from the body. Whereas the mammalian tissues are less affected by the drug because the cholinergic receptors in mammalian skeleton vessels have very low affinity for the PYRANTEL. So that's why it is not toxic to the host, whereas it is toxic to the parasites itself only. That's how it is doing. Then this is the diagrammatic representation of how levomethol and the PYRANTEL are going to act. So the PYRANTEL palmoate, etc. So they have got the ligand-gated ion channel receptors, especially nicotinic type of the receptors, and they are going to act and block that particular receptor. So that's the simple mechanism of action. So the anthelmintic spectrum, as usual, it is effective against the GI nematodes and larval stages of the different parasites in the lumen and also the mucosal surface. And the horses, especially the strongylls, especially in case of horses, the strongylls, it is effective. So strongylls are one of the common most helminth infections, and dogs, all GI nematodes, including the ascarids, especially the Toxocara canine, then the Ankylostoma caninum. So these are the important these ascarid worms or roundworms and hookworms, and the stomach worms. But it is actively against the whipworm. No? It is erratic. It cannot be. We cannot guarantee, especially PYRANTEL and the MORANTEL, etc. Then cattle, sheep, and goats, Haemonchus, Osteotegia, Trichostrongylus. Yes, this is especially PYRANTEL is highly effective against the one of the most common worm of the large animals, that is the strongylls. Then, so it is also effective against the Haemonchus contortus, Couperia, and the Eusopogostomum species. Swine, yes, it is. Of course, this is also very effective agent in case of the canine hookworm infestation. But this is not at all having any effects on the cystodes, that's the tapeworms and trematodes, the flukes, except in case of horses. But in very large doses in horses it shows, but it's not a routine parameter. Whereas the kinetics, then absorption and onset of the anthelmintic action of the PYRANTEL depends upon its salt form of the PYRANTEL palmoate, which is poorly soluble in water. So its absorption from GI is it's very poor. That's very much required. Whereas in case of antibiotics, etc., we require very high concentration, a very high absorption. So this allows it to reach the lower GI tract, producing very good activity against the bowler worms, that is the pinworms. So pinworms, especially, they especially in case of small kids and newborns, the pinworm is a very common phenomenon which irritate the rectal mucosa and the itching is caused. So in them, the pyrantel tartrate is very much dosable because it is water soluble. And in ruminants, absorption of pyrantel tartrate occurs less well, and in the peak plasma concentration level occur at variable times. And after absorption, pyrantel is rapidly metabolized and excreted via feces and also through the urine. Then side effects and adverse effects, of course, it is very well tolerated. Pyrantel, of course, it's one of the safest anthelmintic when compared to the benzimidazoles also. So the safety index is very high, that is 20 times in the other species and up to 7 times than that of the therapeutic doses. So, however, MS may occur in case of the dogs in the normal dose itself. So, the overdose of the pyrantel has been associated with the toxic signs of this ataxia, tachycardia, and profuse sweating and other cholinergic effects. So, coming to the contraindications and precaution, pyrantel should not be administered, especially in case of weak animals and debilitated. So they will get all the toxicity signs, as it is a non-specific cholinamimetic agent, and also not recommended in case of the foals that less than 4 weeks of the age. Just like the ivermectin, it's not indicated for poorly bred of dog and also less than 12 weeks of the age. Whereas the pyrantel is safe for the pregnancy. That one should be, it's important, especially most of the anthelmintics are not safe in the pregnancy. So including the thiabendazole, albendazole, etc., except the fenbendazole. So the fenbendazole and pyrantel palmoate are the most safe anthelmintics in case of the nursing mothers, or the milk excretion is very, very less. So whenever you are doing a mass deworming program, this is very much required, this type of the properties, which anthelmintic should be selected. So I think you are getting, because we do not know which animal is pregnant, which animal is lactating, which animal is not lactating, which has got the newborn calf, etc. So whenever we are doing the mass deworming, then pyrantel should be selected because it is safe for you in the pregnancy, in nursing mothers also. Then drug interaction, it should not be concurrently used with drugs having similar mechanism of action, especially the OPC compounds do have the similar type of the mechanism of action, and also the tetramethyl and levomethyls. And the piperazine causes hyperpolarization and flaccid paralysis. It is antagonizing the action of the pyrantel, because pyrantel is having the parasympathomimetic action, whereas the piperazine has got the hyperpolarization action, and hence it may antagonize each other. Then the clinical use is, it is approved by, especially in case of the horses. Pyrantel is approved mainly for the horses, pigs, and the dogs. Whereas very highly it is effective against the hookworms and also the roundworms. In horses, it is very much useful against the roundworms, large strongyles, and also the whipworms. Whereas it is effective against the horse tapeworms at double the recommended doses. So it is not approved in case of the cattle, sheep, and goats by WHO, but it is still used without any much great disadvantage. So dose of the pyrantel, palmoate, etc., dogs and cats, it is 5 milligram and orally repeated in 3 weeks of time. And dose is 14.4 milligram per kg. As pyrantel palmoate is there. Pyrantel palmoate oral suspension is there, especially the trade name, especially in case of the human being, is nemocid. Nemocid is one of the most popular trade name. The sheep, goat, and cattle. Then morantel citrate or morantel tartrate is also the analog of the pyrantel. So it acts as the depolarizing neuromuscular blocking agent, especially in case of the target parasites, thereby paralyzing the susceptible this organism. Then, just like the tetramizole, it is going to block the fumarate reductase enzyme, and in some nematodes. There's also the Haemonchus species. Haemonchus is a blood-sucking parasite, and the morantel is lower than pyrantel in its onset of action. So, but it is several times more potent. It may be slow action, but highly potent. So, the ban mint, or here Dan mint, or it's one of the most popular trade name, especially the shepherds. They do like this ban mint, especially from the Pfizer pharmaceuticals. So it is very well absorbed from the upper intestine, and it is safer and more effective than pyrantel. Then it's approved mainly for cattle. So the morantel is mainly approved for cattle and also the other ruminants, especially the immature and mature one. So it is preferred over than that of the pyrantel permanate. So cattle 8.8 milligram, sheep 10.10 milligram per kg body weight. So the next drug is the OXANTEL. It's a narrow spectrum anthelmintics, and only against the whipworm, that is Trichoris species. So it's also available as the oral administration agent, and it is not absorbed. The dose is little high when compared to the morantel. Then OPC compounds, of course, these are the organic esters of phosphorus that were largely used in case of the pesticides. But nowadays, it is very less used because of the very high toxicity, whereas it is used as the ectoparasiticides. Very low margin of the safety means they are highly toxic, and nowadays almost all the OPC compounds are replaced. Even then you need to know, because few of the compounds are still in the market in different countries. Mechanism of action, you know it very well that these compounds are the acetylcholine esterase inhibitor, so that more and more acetylcholine occurs, this accumulates and causes the parasympathomimetic action. So both these mammalian and parasitic cells are equally susceptible, but inhibition of the ACHE to some extent, especially in case of mammals, it is non-specific. So it is highly toxic to both the parasites as well as the host. Hence, we should reduce the use of the OPC compound as much as possible as an anthelmintic. So this is the mechanism of action, because the acetylcholine esterase enzyme is present here. So acetylcholine comes and it binds with the specific receptors and initiates the action, and later it need to be broken down. So the acetylcholine esterase enzyme, which is present in between the neuroeffector junction, it is going to break down acetic acid into acetic acid and choline. So this enzyme is blocked so that more and more acetylcholine get accumulates and stimulate the post-synaptic, both nicotinic and muscarinic type of the receptors. So among these, most of them are the these agrochemicals, whereas few of them are used as the insecticide, like the dichlorvas, or it is still used as anthelmintic and ectoparasiticide in some countries, not all countries. Of course, these are not approved by the FDA. And these are effective against the weepworm, nodular worms, strongyloids, hookworms, etc. Then dichlorvas is effective against the bots, external application, the strongyles, ascarids, and also the pinworms. Whereas it is very less effective against the ruminant nematodes, and of course it is not safe in case of ruminants. Hence, the academic only we can study some of these things to name some of the products like this dichlorvas, etc. So these letters we can skip this what you call as the organophosphorus compound. You just know the mechanism of action and the safety. If they are totally unsafe in case of the animal, we should avoid as much as possible. So adverse effects, we know the parasympathomimetic effect, like especially in case of OPC compounds. There is sometimes in case of dogs, the constipation is seen, then followed by the severe diarrhea, mechanical blockade of intestinal tract. Then the dichlorvas should not be administered in conjugation with other anthelmintics because it may cause the additive toxicity. Or it should not be used with anticholinesterase agents like the physostigmine, neostigmine, etc. Then neuromuscular blocking agents like D2-gocuralin or CNS depressants, maybe any anesthetics, etc. Then the dose of this dichlorvas is 30 to 40 milligram per kg body weight orally. So OP compounds should not be used in young or pregnant animals because they are susceptible. So even then, some of the trade names like this Deroxa, you are seeing in other countries, they are available. Of course, a few of the compounds are also available in India. Then trichlorfon, of course, yes, this is also another OPC compound. Actually, it was approved once upon a time in case of uses in horse, pigs, and dogs when there was no alternative available. So it is a prodrug, and it will react with the nematode ACH enzyme. It will inhibit and causes the spastic paralysis. So it is effective against ascarids, oxyurides, and bots. So, once upon a time, this was used in human beings as an alternative to praziquantel for the treatment of urinary schistosomiasis only, urinary schistosomiasis, because the praziquantel, even though it is very sometimes effective against the some of the nasal schistosomiasis, etc. flu, so it is not having good concentration in the urinary tract. Hence, the trichlorfon was used. And when compared to the other drugs, OPC compound, this is little safe. The toxic manifestation and contraindication of this trichlorfon are same as the dichlorvas. So this is having very low margin of safety when compared to the other antibiotics. So the dose is 40 milligram, and pigs it is 50 milligram per kg 2 times. And COUMPAPHOS, it is, as the name indicates, PHOS means it is indicating that it is a OP compound. So here, COUMPAPHOS is the OP compound approved for use in cattle and some of the other ruminants. So of course, this is Haemonchus, Osteotegia, Trichostrongylus, and Coparia species. It is effective. So this is not having good margin of safety. So here you can see that it is having the oral preparations. One need to be very careful about the doses. It should not increase more than the effective doses, especially in case of the large animals. Then HALOXON is another OP compound approved for the anthelmintic for cattle, sheep, pigs, and horses. So it is closely related to this COUMPAPHOS. and mostly active against abomasal and the small intestine parasites. It is having the safety index of 3 to 10 times. That means many times if we are administering the little higher dose, then it may cause the toxicity. Then this coming to the piperazine category of the main class of anthelmintics, only this piperazine and piperazine analogs like this diethyl carbamazine citrate, which is effectively used in case of the heartworms. So these are piperazine is once upon a time it was a drug of choice in case of the ascarid worms. But it was it is piperazine. It is active against the ascaris. Then it is piperazine chemically known as diethyl anidamine. So it's a cyclic secondary amine anthelmintic. Then so it is a strong base and easily absorbed into the water and carbon dioxide. Therefore, should be protected from light, and it should be preserved in airtight containers. The one important thing to remember is it is available as varieties of the salts like piperazine citrate, adipate, phosphate, hexahydrate, chloride, sulfate, and dihydrochloride. So each salt contains variable amount of the piperazine as base. Sometimes the piperazine citrate contains the 35% of the total piperazine. Then adipate 37, phosphate 42, whereas it is very high in case of piperazine dihydrochloride 50 to 53%. Then the dosage of this piperazine is expressed in terms of the what you call as the equivalents. That is 100 milligram of piperazine is equal to 120 of piperazine adipate equivalent. So, or 125 milligram of piperazine citrate. So, accordingly, we need to calculate the dose. Coming to the mechanism of action, the anthelmintic, especially the piperazine, is depending upon the release of the free base from the piperazine adipate, citrate, etc. So it's a GABA receptor agonist. GABA receptor agonist. It increases the chloride conductance as the parasite's nerve membrane and produces the hyperpolarization and reduces the excitability at the NM junction or the neuromuscular junction. That's why it causes the paralysis. It is going to relax the muscles, whereas the levomyosol, PYRANTEL, etc., they are going to contract the muscles of the worms. So it is producing the anticholinergic action at neuromuscular junctions, and it blocks the acetylcholine and blocks succinate production by the few of the worms. The paralyzed worms are depleted of energy and soon lose their grip on the intestine because they will be adhering to the intestine with their mouth or the scolex sometime, and the intestinal wall will be adherent, and they are going to be expelled by intestinal peristalsis. As they loosen from the intestine, these will be expelled in the feces. Coming to the anthelmintic spectrum, these are all the narrow spectrum anthelmintic, only effective against the roundworm, especially ascarids and the nodular worms in most of the species. So there is variable activity against hookworms and also the strongers. And very rarely they are effective against the TF worms and whipworms. Then mature worms are more susceptible to the action of piperazine than young and larval stages. So coming to the kinetics, so the piperazine, it is a water-soluble salt, then it's absorbed from GI tract after oral dosing. And some piperazine is metabolized in liver, and remainder, especially 30 to 40%, is excreted by the 30 minutes and virtually complete within 24 hours. So the piperazine may be in the any other salt form like piperazine citrate, adipate, and hydrochloride, hexachloride, etc. They are going to be metabolized in the liver, and about 30% is excreted in as the piperazine starts. Then side effect, yes, when compared to the this organophosphorus compounds, etc., this is safe at the recommended doses. However, there are certain GI disturbances like vomiting, diarrhea, ataxia may be noticed in case of the dogs and cats. And the massive overdose may produce weakness, dyspnea, then muscular fasciculation, ataxia, and sometimes the hypersalivation followed by depression and slowed papillary responses, and there is a ultimately their death will occur. So this is somehow common because the farmers many times they purchase the human piperazine compound and thinking that the animal has not passed the worms in the feces, which is an indicator of worm infestation. They will drain 2 or 3 bottles. In villages, this happens. The farmers come to the medical shop and purchase 2 or 3 bottles of the 60 ml piperazine citrate and drain at the same time. At that time, it is going to be absorbed into circulation, produces all these side effects. And it need to be treated symptomatically. Of course, we can use this atropine sulfate and the fluid therapy and diazepam even there is a convulsions. So there is no absolute contraindication of the piperazine in case of the large animals. But in case of patients with having the chronic liver or kidney diseases, it need to be used very carefully. And it's a provokes seizures in patients with a seizure history of the renal disease. Or so some of the animals will do suffer from the grand mal or petit mal epilepsies, and if you administer the piperazine to such animals, it is getting exaggerated. So in small puppies and kittens, particular care should be taken to assess the body weight accurately to minimize the risk of ataxia due to overdosing. That's also one of the possible thing. Then it should not be used in combination with PYRANTEL or MORANTEL because the mode of action of these 2 drugs are antagonistic, because one is parasympatholytic and another one is the parasympathomimetic. Especially the piperazines are parasympathomimetics, whereas this MORANTEL, PYRANTEL, etc. lytics. So the drug is eliminated through the feces, and the efficacy is established of this piperazine, and seizures, especially they are going to induce seizures and they can be effectively treated. So this is used widely for the treatment of ascarides in dogs, cats, horses, swines, and poultry, all these animals. But in case of ruminants, it is rarely used alone because the chances of the resistance is there and also the toxicity. So the dose is expressed as piperazine hydrate. All the other drugs, citrate, etc., adipate, etc., they are expressed as the piperazine hydrate. So the dose is 80 to 100 milligram and 120 to 240 milligram per kg, especially in case of Ankylostoma caninum. That's the canine hookworm. So dogs, it is their dose is high, especially. So in case of cattle, the 110 milligram per kg on an average may be used, or simply you can remember 100 milligram per kg. That's also okay. Diethyl carbamazine is a citrate, is a piperazine derivative, and it occurs as a white, lightly hygroscopic crystalline powder, and that is highly soluble in water and slightly soluble in case of the alcohol. Whereas similar to piperazine, it acts and paralyze the worms, especially the paralyze the worm, but the exact mechanism, how it is very specifically acts on the worm is not yet understood even after so many years of use of the DEC. This is still a drug of choice in case of heartworms. But nowadays, this ivermectin has replaced the DEC, diethyl carbamazine citrate, so filariasis or elephantiasis, and also the ascariasis. So this Dictyocalus vivifera, it's a upper respiratory tract worm, or it is going to be controlled by the use of the DEC, diethyl carbamazine citrate. So after oral administration, this is properly absorbed into the circulation, and the drug is widely distributed to all the tissues and organs. Whereas especially in case of tax, it is not one, and it is readily metabolized in the liver and excreted as both metabolite and also the parent drug, unchanged, and both of these are excreted in the urine without any change, metabolic change. So it is safe in the recommended doses, but some dogs may develop GI disturbances. So this is a very rare situation, just like the vomiting, diarrhea, etc., due to irritation of the GI mucosa. So it should not be administered along with the heavy food because it reduces GI irritation. So it is always indicated that this drug should be administered after lunch or dinner to human beings and after a very good feed of the hay or also the green fodder or the concentrates in case of cows. So the dogs with heartworm infestation with circulating larvae, because all of this will die suddenly and get clogged the arteries, different arteries. And so in such animals, it is not indicated. Or diethyl carbamazine citrate is approved mainly for the prophylactic use of the heartworms, not the therapeutic use. Because if you use it in the therapeutic concentrations, then at the same time, massive worm death is seen, and this will go and clog the smaller arterioles. For prevention of the heartworm, it is usually administered 1 month before the start of the mosquito season, and thereby then the therapy is continued until 2 months after the end of the mosquito season. So before the mosquito and after the mosquito, this need to be used. End of the season also, this should be used, because mosquitoes are one of the carriers of the heartworms, and you know it, the cycle, etc., very, very well. Then the efficacy against the other paralites, and it is, as it's a very specific drug for the microfilariae, it should be freed for adult heartworm and the microfilariae, because these are the ones which are going to cause the toxicity, especially not only cause toxicity but also the worm infestation, and ultimately they are going to cause the death of the animal. So how to prevent the heartworm infections? The dogs we need to administer the DEC, that is 6.6 milligram per kg once daily for a month of the time, especially in the certain feed this worm infestation area. So DEC 55 to 110 milligram. Then on Dictyocalus infection, it is used as the intramuscular for 3 successive days or 45 milligram per kg. Arsenicals, so they are the well-known poisons. Then of course, these are the drugs used once upon a time, but now they are seldom practiced because of the high toxicity. Only thiacetasamide and melarsamine are used arsenical drugs. And thiacetasamide is an organic arsenical compound. Whereas the mechanism of action, the exact mechanism is not clearly understood. So it is trusted or believed that the therapeutic action is primarily due to the reaction between the arsenic moiety and the sulfhydryl containing enzymes, and also few of the proteins. And yes, inactivation of the parasite enzymes and the system produces the death of the susceptible heartworms. So heartworms are very commonly treated with the diethyl carbamazine citrate. Then thiacetamide is effective against the adult heartworms, especially Dirophilaria immitis. This is the heartworm. So it has no efficacy against immature worms, whereas this is only effective against the mature heartworms, the thiacetamide. So it is administered as the intravenous route for the treatment of the heartworms. But one need to be very careful, because the fast IV injection may also cause the death of the animal. And thiacetamide concentrates mainly in the liver and to a less extent, especially in the kidneys. It is not going to be accumulated anywhere else than the liver, because the metabolism need to happen in liver only. Then kinetics. So the adult heartworm concentrates in the thiacetamide in quantities greater than that of the liver, whereas the thiacetamide is rapidly metabolized in liver and excreted in bile, and also in case of the urine. So it has an anthelmintic half-life of about 45 minutes and clearance rate of the approximately 200 milligram of plasma per minute. That means it is very fastly eliminated. So side effects, as anticipated in many of the other books also, so they have got the narrow margin of safety because they are highly toxic substances. So adverse effects related to arsenic toxicity especially may occur at the time of the therapy. And it is very severe also. And as far as possible, we should not use these agents. So the adverse effects in case of dogs include the vomiting, hepatotoxicity, nephrotoxicity, and thrombocytopenia. So you know what is that thing, and severe local inflammations, irritations, and sometimes the sloughing up of, and also the phlebitis is noticed whenever there is a thiacetamide injection is given, especially extravascularly, means whenever the animal is struggling and not cooperating, there is a chance that the drug may go extravasation and local reactions, irritation, etc. And ultimately the sloughing up of the action will be done by the thiacetamide sodium. So the dead worms usually accumulate in the caudal liver lobe, and there is a chances of accumulation of the fluid in the lungs. Then persistent vomiting, which may be indicative of liver toxicity, then may require the discontinuation of the therapy. Treatment, as usual, the antidote for the dimercaprol is a specific antidote, a chelating agent. It is also called as British anti-lewisite. So it can be used as an antidote to the thiacetamide sodium overdose. Whereas the glucocorticoids have been recommended to treat symptoms of the pulmonary thromboembolisms. So the use of the glucocorticoids is also once again controversial. Some say that it should be used, or some say that it should not be used because of the drug interaction, number one. Number two, the corticosteroids always do the suppression of the immune response. Then CIs or contraindications, and some of the precautions need to be taken while administering this drug. So this drug is not indicated in the impaired hepatic, renal, or the cardiopulmonary functions. And patients with diabetes mellitus, broad hypoadrenocorticism, or the GI disorders, maybe the worm infestation, etc., should be carefully monitored during the thiacetamide therapy. So the treated dogs should be provided with full rest and restricted diet also, but there should not be no water deprivation. So what happens is if it is not properly taken the attendance, there is a danger of massive pulmonary emboli. So emboli is the flow of the, especially, yes, this is extreme care must be taken to avoid the perivascular leakage, or else it causes the severe phlebitis or inflammation of the vein. And before and during the treatment, a thorough evaluation or the kidney and liver function tests should be done, especially as it is a very heavy metal derivative. One need to be very, very careful. And drug interaction, use of glucocorticoids during thiacetamide therapy, it possesses a protective effect on the adult heartworms, especially in case of the cattle. And this may decrease the efficacy of the thiacetamide. Whereas the glucocorticoids are recommended in only in case of patients that develop acute pulmonary emboli and even after the thiacetamide therapy. So these are recommended glucocorticoids administration, but develop acute pulmonary emboli. So because of the chemotactic factor, so this should not be used. So of course, the thing is the thiacetamide is exclusively used for the treatment of adult diarrhea emetis infection in case of dogs. So repeated thiacetamide sodium therapy at intervals of new months usually do not complete elimination of the worms. So we cannot say the guarantee. So this is not approved. Of course, even then it is used over the counter. Then melarsamine is also another organic arsenical compound. It contains the very less of quantity of the arsenic when compared to the thiacetamide sodium. And it's used in the diarrhea emetis, then when compared with thiacetamide sodium. And melarsamine appears to be more efficacious or less irritating and less hepatotoxic. So melarsamine is administered by deep intramuscular injection. This is the injection, just like the ivermectin. The melarsamine is also effective against certain dermatological disorder, and it is injected as the intramuscular injection and rapidly eliminated with the half-life of just 3 hours. The toxic dose is very less, that is 2.5 to 3 times the recommended dose, or else the animal is going to die. So the toxicity signs are which are correlating with that of the arsenical toxicity. So there is a panting, salivation, vomiting, diarrhea, pulmonary congestion, fever, and the edema may also be seen. Whereas it may also have the pain and swelling at the site of the injection because the drug is having irritant property. Then sometimes the overdose may produce the ataxia, incoordination, stupor, cyanosis, and sometimes it may cause death also. Whereas the melarsamine is contraindicated in cats due to the severe toxicity and dogs with the class 4 heartworm infestation. That means very severe infection. The thing is, if you administer the anti-heartworm drugs, they go and clog some of the capillaries, especially in case of bodies. So many thousands of capillaries are there. There is a chance that these drugs may get clogged there. Melarsomin is not recommended for the IV and the subcutaneous route due to the significant toxicity and also the tissue damage, respectively. The safety of it is not at all established, and it should not be indicated in pregnant and lactating animals. So, of course, the dose is the 2.5 milligram per kg deep intramuscular into the lumbar epaxial muscle. It is L3 to L5. That's important because the dose need to be administered properly for the proper route of the administration. Then glycobiazole is another arsenical compound containing the powder. It's poorly as far as the oral administration and is considered useful against the whipworms. Then a second course, especially those. So second course of the treatment after 4 weeks is often required for the complete elimination of the parasites. And it does not require fasting before the anthelmintic administration, hence you can administer it at any time of the day. The dose is 22 milligram per kg for the 5 days. Arsenamide is also another arsenical derivative, and rarely for the use of the treatment of the canine heartworm, especially in case of the adult stages, it is used. Then tomorrow we will learn, or the Monday we will learn about the substituted phenols and the sulfanilamides. So anyway, we will have the class on Monday 9:30 to 10:30, and